Now to our state of addiction coverage. In Santa Cruz, drug needles continue to be found in public places at an alarming rate. Action News reporter Bianca Beltran joins us with more on the epidemic and the risk to the public.
That's right, Aaron, and unfortunately it seems to be a growing problem. On average, volunteers and city employees find over 260 needles each month. Now that's a lot, but in this last month, 562 needles were found. That is more than double, and these syringes are a sign of a growing epidemic.
I have a 5 and an 8-year-old. They know what hypodermic needle looks like. They know whether or not it's loaded with heroin. These are not things that our children should know.
In Santa Cruz, used drug injection needles can be found almost everywhere. Over the last 4.5 years, more than 14,000 needles have been found at the beach, in parks, near playgrounds and schools. A dozen people have been stuck with them, and half were children.
We had an incident where one child put it in their mouth. They thought it was a thermometer. Your child has to get stuck with all of these additional needles for the Hep C virus, for HIV, and for months not knowing what's going to happen.
The county runs a syringe exchange program, taking used needles and replacing them with clean ones. The goal is to get the drug users into treatment.
A lot of the folks who have a substance use disorder have a lot of other problems. And the reality is it's very hard to rehab somebody with a substance use disorder if they're unsheltered.
The county has partnered with various nonprofits to reach those who don't exchange their needles and is looking for federal grants to expand their outreach. But changes in health care could put their efforts in jeopardy.
If the Affordable Care Act is repealed and Medicaid funding is decreased, we will have a significantly more difficult problem in dealing with this substance use disorder epidemic, because we need Medicaid in order to do the physical and mental health care that these patients need. Without Medicaid, we're not going to be able to do it.
And again, this is a problem that they have teamed up with nonprofit organizations such as Behavioral Health and the Homeless Health Project to reach other drug users who aren't coming in to get those needles, but federal funding will be very important to make that happen.
All right, thank you, Bianca. On average, volunteers, they find thousands of, on average, volunteers and city employees find over 260 needles each month. In the last month, 562 were found. That's more than double. These syringes are a sign, they say, of the growing epidemic. Last month, the California Supreme Court decision today upholding the right of the state medical board to access a prescription drug database. Case stems from a Burbank doctor who was investigated after a patient complained that the physician suggested that she go on a diet. Now, while the board found that he didn't provide improper care to that patient, it later put him on probation for providing excessive prescriptions to 2 other patients after they began digging through his prescribing history in a state database. Court ruling today that the medical board did not violate the patient's privacy by accessing that information.